Hi there, Paul Silovsky here, physical therapist and owner of Rebound Physical Therapy here in Topeka, Kansas. And today I wanted to talk to you about treating sports injuries with physical therapy. Probably one of my favorite subjects, being a sports-minded or sports medicine-minded physical therapist for many, many years, treated thousands of athletes in my career. And actually being one too and receiving physical therapy following my sports injuries, I have the total reality on this. So listen, sports medicine or sports related injuries aren't just for professional, college, high school, or club sport athletes, people that are actively competing. There's probably more recreational athletes or ex-jocks like me that are continuing or wanting to continue with either a lifetime sport or maintain that competitive athletic mindset or edge. I actually call it an athletic model of treatment that I use in physical therapy to treat sports injuries because it's super important for the return to activity, safe return, for prevention and for restoration of your normal, motion and function, not just your daily functions and motions and strengths that you need to accomplish your daily activities, but it requires more training, more recovery, a more defined program for someone to return to their previous level of activity so that they don't further injure themselves and they can enjoy it, right? So with sports injuries, there's a myriad of injuries. Like I'm not going to get into the different types, but you can pretty much go by joint or area. There's all kinds of sprains and strains of the spinal area, the neck, mid back, lower back, but shoulder injuries, rotator cuff, right? People tear the rotator cuff, they get rotator cuff tendonitis, tennis elbow, which is an inflammation of the tissues here. People can tear the ligament on the inside. I won't get into the technical terms here, but have that repaired for throwing injuries. There's a particular name for that surgery. One of the more common things you hear about, probably the most prevalent injuries are in the knee, right? Anterior cruciate ligaments, or people call it the ACL, cartilage tears, medial ligament tears, ankle sprains. The list goes on. I'm not going to list all of them, give you some of the major ones we see, but they all require a different approach depending on if there's a bony injury, if there's an injury to the supportive structures, the ligamentous structures that give you stability, which are those tissues that don't contract like a muscle contracts, right? The ligaments do not. They're static. They're there to provide support. But if you have an injury to contractile tissue, like my biceps, tear your biceps, or someone strains their hamstring, right? A sprinter or a runner strains their hamstring. All of those require a bit different approach to the recovery process. I'm not even mentioning nerve injuries here, but they can occur in sports injuries for sure, require their own set of treatment. So it can get pretty complex, but you have to be put on a program that's going to restore normal strength, mobility, function, decrease inflammation, but more importantly, prevent you from further injury when you return. A lot of people try and go back too fast just because they're feeling better. Maybe all the structures aren't healed, but when you're going through a recovery period, you will potentially lose, strength, mobility, awareness of your ability to correct your body in space when you go back to, say you sprain an ankle. If you don't work on the balance and your body's awareness of its position in space and the ability to react to the ground so that you don't, re-injure yourself, you're going to put yourself at risk. And that's why you need to be working with a physical therapist, particularly trained in this area of sports medicine or athletic medicine, the athletic mindset, because I know and our therapists know what you need to be able to return to. There's special tests that can be performed that are not just joint specific tests, but functional tests that test your ability to function in the environment that you want to go back to. Really, really important element for your program to make sure that not only your structures and tissues are healed, but your ability to move and function properly at your activity or your desired level of activity, that is restored to normal. So listen, if you have a sports injury or someone reach out to Rebound. Love to talk to you about it and help you out. Call us at 785-271-5533. We love to help people recover from sports injuries and get back to the life they love.